Today, in the style of a good old-fashioned whistle-stop tour, the Oklahoma Institute for Child Advocacy is going to ask the candidates for Oklahoma governor to share their platforms and the priorities they have regarding children's issues. So it's my privilege at this time to introduce our candidates. Lieutenant Governor Jerry Askins. Attorney General Drew Edmondson. Fact: obesity may soon overtake tobacco use as the #1 cause of disease and disability in Oklahoma. Since 1980, the percentage of children who are overweight has more than doubled, and rates among teenagers have tripled. Question: what are your plans to address the crisis of childhood obesity in Oklahoma?
You know, I grew up during the time when the President of the United States has a President's Council on Physical Fitness, and I don't understand why a governor can't initiate a Governor's Council on Physical Fitness and try to lead by example from the top, that we need to place an impact on motion, students of all ages. We're all kids of all ages, getting out and being active.
We need to work on getting all of the junk food out of all of our schools to help in that problem. Put in healthy snacks instead of junk food. We also need to expand that, as I read in the morning paper, is being done in both Delaware and New York, and start putting as part of the licensing requirements for daycare that they not be serving junk food in our daycare and in our pre-K program, and expand it in that direction as well.
Fact: teen birth rates in Oklahoma have ranked significantly higher than the national average for decades. And did I just see the latest Kids Count report puts us 7th? Yeah, it's not good. This leads to higher dropout rates, decreased opportunities for employment and family stability, and increased stress and struggles for the child. Question: how will you address the issue of teen pregnancy prevention?
On the one side, it needs to teach self-esteem. On the other side, it needs to teach responsibility. It needs to be a dual approach, and it needs to start early. I am somewhat disturbed by the fact that Oklahoma is one of only 2 states, Oklahoma and Colorado, that does not mandate health education in our schools. We need to change that.
We have obstructions at the Capitol saying this is not an appropriate subject to be taught at the schools. That it's important for these lessons, sex education lessons, to be taught in the home, and unfortunately, homes aren't like they were when I was growing up. And even if there are parents, there's not the grandparents and that family structure around to help support and be the example many times for these young girls and the young men who think it's okay to have sex. Now,
how should our state ensure adequate and equitable financing for our public schools?
We are not going to talk this legislature into increasing funding for education unless it's coupled with more accountability from our schools. We need to be able to assure parents that they're going to get the highest quality product by sending their children to the public schools.
So I support any effort that is made to make sure that our curriculum is meeting the needs of our students when they enter the workforce. Whether it is a change to look at what college requirements are, or in working closely with business to understand what the needs of the workforce are. Because that needs to be our goal, preparing our students for what they do when they complete their education at whatever level it is. The goal should not be what the score is on a test. The goal should be, how much have I learned to become a productive citizen in the state of Oklahoma?
Fact: Oklahoma ranks first in the nation in child abuse fatalities and has the 5th highest rate of teen deaths from all causes. How do you propose to keep all children safe from violence in their homes and neighborhoods?
We lobbied for 3 years to get the domestic violence programs moved from the Department of Mental Health to the Attorney General's office. Not that there aren't mental health issues involved in domestic violence, but first and foremost, it is a violation of the law, it's a crime, and it must be treated as a criminal justice issue.
There's so concerned about an Office of Homeland Security, but I would tell you, our nation will not be safe until our children and our families feel safe in their own homes. So for me, it's not about Homeland Security, it's about home security. And whatever we can do to help provide a loving, safe, secure place for children, whether it is with their blood relative, their biological family, or with someone who has stepped in to fill that need, we owe that to them.
I think that Jerry Askins and I would agree that anybody who doesn't have the children of this state as their #1 priority doesn't have any business being in government. That's the way I feel.